Hi, I'm Dr. Mea, a rehabilitation specialist focusing on neuro recovery, currently a medical advisor at Moleac. Today, I'll be talking about cognitive challenge that can occur after traumatic brain injury, also known as TBI. Cognitive impairments are very common after TBI. Each patient is affected differently, and the challenges can range from mild to severe. Patients with a mild TBI may only experience short-term and minor cognitive impairments, but those with moderate to severe TBI, the impact can be much greater, often affecting the ability to carry out daily activities. For example, some patients may no longer be able to work or drive safely after their injury. The most common cognitive areas affected include attention, problem-solving, and the ability to switch between tasks. Yes, some do, but to different degrees, depending on multiple factors, such as age, baseline cognition, and the severity of TBI, etc. So recovery may not be complete for everyone. However, with active cognitive rehabilitation, some symptoms can improve over time. Cognitive rehabilitation can be classified broadly into two categories: restorative and adaptive. The first approach is restorative. It aims to strengthen cognitive abilities through brain exercises. In other words, it helps the brain to repair to some extent. In some cases, this can also be supported with medication. The second approach is adaptive. Patients are taught practical strategies to cope with their cognitive difficulties. For example, I usually advise my patients with short-term memory problems to write down tasks or set reminders on their devices to recall their routine tasks, such as taking medications. With the right rehabilitation and support, many patients can regain important skills, adapt to challenges, and manage their daily life better.